Hi, this is J. Francois Yee, the Director of Advanced Urological Care, a practice focused on the treatment of advanced erectile dysfunction. Today I want to talk about the myth regarding penile implants. And the reason I picked this topic is that from a lot of the questions that I get, I realize that there's a lot of misunderstanding regarding penile implants. The first and foremost is that a lot of young men think that a penile implant is like a breast implant, that it will enlarge the penis. Penile implants do not make the penis bigger. At best, we want to try to get the same size as the penis was when you had potency. So that's myth number one. Myth number two, an inflatable penile implant is less reliable than a rigid implant. As a matter of fact, these rigid implants are more difficult to put. For some patients, you need a bigger incision in the corpora, and they're more painful. The patient is always hard, and they tend to erode. So for a lot of patients, this is going to be a more painful procedure. Myth number three is that the penile implant is only for the partner. It's not going to give me any pleasure. Actually, you have orgasm and ejaculation with a penile implant. We have patients that are over 70 years old and they'll have 2 orgasms in one evening. Myth number three is, can I still have a baby with a penile implant? Yes, you're totally fertile. There is no issue with that. We have many patients who have actually become fathers after a penile implant. Another myth is that I have to wait until I'm cancer-free before I get an implant. Actually, the implants don't interfere with cancer treatment. You can have an implant before radiation treatment. You can have an implant during or after getting chemotherapy. We've done it, especially regarding hormone therapy for Lupron. Sometimes it's even better to get the implant before getting hormone therapy, because the hormone therapy will shrink the penis, and then you're left with a smaller implant in a smaller penis. And then also, other myth is that the implant will interfere with urination. Actually, the implant is not in the urinary tract. It will not interfere with urination. However, many patients who have erectile dysfunction also have problems with urination, and it's important for the urologist to diagnose these just to make sure that the patient doesn't have hesitancy, difficulty urinating after getting an implant. Those are some of the very common questions that I get regarding penile implants. Some patients even think that the pump is sticking outside the skin. That's another myth. The pump is inside the skin and it's completely concealed. A lot of patients think that an implant can be put in and then taken out and I get back my regular erections, and that's not true. When we put in an implant in a patient, we're going to fashion space in the penis, and in the process of doing that, you alter the erectile tissue. However, there's still erectile tissue in the patient. We don't remove anything from the patient to put in a penile implant. So there's still, some patients still have partial erections. Another myth is that the head of the penis is not going to be full with an implant. And if the patient inflates the implant in the doctor's office, the glans penis, the head of the penis, it may not get engorged. However, if the patient is in the comfort of his home, having sex and with foreplay, the head of the penis may swell. Another myth is that the implant will make my penis shorter. It's actually not going to do that. If it's well done and well sized, the implant will be the same size as the penis before the implant. I hope that this answers most of the questions that one has, and I invite you to email me any additional questions that you may have, and I will be prompt in answering all of these questions. Thank you very much.